Good morning, good afternoon, good evening. Uh, let's start with the micro circulation yoga or micro yoga for blood circulation. Let's start with rubbing our palms over each other. Let's activate our body for next 25 minutes and then cool down. We are going to definitely go for a very important asana position today, and that position helps us a lot in keeping our digestion good. So before that, anybody who has any ailment of particularly that organ of which we are doing the asana, please connect with your physician or doctor. Then only you do it. Secondly, those ladies who are pregnant, they should avoid any stretchful asana, or they should connect with your doctor. Those who have any injury of particularly that organ of which we are doing the asana, they should please refrain from it. They should connect with their doctor, take a consult, and then only they do it. Okay, this is very important. I'll during the asana I will tell about the contraindications. Definitely, we have to take care. You should have a supporter. You should be empty stomach, and you should have a mat. One more point is you should do it up to your capacity and not more than that. Let's rub our palms over our face, over our eyes, neck, and ear. Take a deep breath and breathe out. Keep our both the hands over the side, abdomen. Take a deep breath and take your neck back. Observe the stretch with the breath. Keep a distance of 1 feet between your legs. Slowly breathe out. Try to touch your chin to the chest. Again, take a deep breath. Take your neck back and observe the stretch. Take it back. Down. Try to touch the chin to the chest with breathe out. Again, take a deep breath and twist your neck on left with a breathe out. Observe the stretch. Keep there for 10 to 20 seconds. Come back and breathe in. And twist it on right, keeping your shoulders the same position. Observe the stretch. Completely breathe out. And slowly come back. While coming back, breathe in. And breathe out. Again, take a deep breath. Rotate your neck in such a way that your ear, try to touch your ear to your shoulder. And while rotating, breathe out. So breathe in and breathe out. Clockwise rotation. Breathe in, breathe out. Breathe in and breathe out. Breathe in an opposite direction. Rotate it in the opposite direction. Breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out, breathe in, and breathe out. Try to keep your both the hands, palms over the shoulder. Take a deep breath. Legs are firmly on the ground and try to rotate the elbow with as much time as possible. Breathe in, breathe out. 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 Opposite direction. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in and breathe out. Take a deep breath and breathe out. Interlock your fingers. Breathe out. Breathe in. And take your both the hands up. Lock together. No angles in the ankles. No angles at shoulder. Straight. Stretch yourself straight. Take a complete breath. Stay there for 10 to 20 seconds. Observe the stretch you have in the chest, abdomen, the shoulders, elbows, wrist. Legs are relaxed that way. The upper body is stretched completely. Slowly breathe out. Take a deep breath again. And breathe out. Again, take a deep breath. Slowly breathe out. Take a deep breath. And wide your hands parallel to the ground in the line of shoulder. Breathe in completely. Take a distance of 2 to 3 feet in the leg, between the legs. And twist your abdomen towards the left so that your right hand palm touches the left hand shoulder. Breathe out completely. And stay there for 10 to 20 seconds. Observe the stretch you have in the back, the abdomen, side, waist, and completely breathe out condition. Keep in mind who has spinal surgery, spinal problems, they should not do it. Slowly come back. Take a deep breath and breathe out. Again, breathe in. Slowly twist your abdomen towards the right and try to touch the left hand palm to the right hand shoulder. Completely breathe out. Twist yourself. This condition, position, be there for 10 to 20 seconds. Observe the stretch and slowly come back. Take a deep breath and breathe out. You may find that keeping your hands apart parallel to the ground, you may have the ache in the shoulder, which is very normal and will come back to normal without pain condition very quickly. Take a deep breath and breathe out. Just take a distance of 1 feet between the legs. Breathe out, breathe in. Take your hands up, parallel to the ground in front of you, and slowly breathe out and bend your knees so that your thighs are parallel to the ground and your backbone is straight, perpendicular to the floor. Completely breathe out condition and smile on the face. Very slowly. Be there for 10 to 20 seconds and slowly come back. Take a deep breath and breathe out. Take a deep breath again. Hold it there and breathe out slowly. Again, take a deep breath and breathe out. So today, be there in the sitting position. So today, we will go for the asana which is known as Janu Shirasana. Janu is knee, Shir is head. So head bow down to knee, head to knee position. This asana is actually given by Krishnamacharya. So in almost more than 80 years back, and this asana is very effective. You will find this effect. Very important about the asana, contraindications. No doubt, pregnant ladies should not do it. Ladies in monthly cycle, they should not do more than even 30-degree extent, or they should connect with their physician and they should not do it. But it is observed that if they do it, happen to do it in a proper way, to their extent, it relaxes the menstruation pain also. They have to connect with their physician, the doctor, for doing it. Anybody who has any knee surgery or knee pain or having the ligaments and tendons hampered or injured, they should not do Janu Shirasana. Anybody who has inner thigh surgery or thigh surgery in the last 6 months to 1 year, or having a pain in hamstring, which is an inner thigh muscle, they should not do it. Very important point is asthmatic patient or asthmatic people, they should not do it. They should refrain from it. Very, very important, because in this particular asana, what we do is we bend down. So it is a forward bending asana. Naturally, those people who are suffering from cervical, they should connect with their physician, and they should only after consent of physician they should do it. So in this asana, when we bend down, found that we also stop the movement of our diaphragm, which is very difficult, and that actually makes it difficult to breathe in. So asthmatic people can definitely avoid it, otherwise it will lead to immediately eruption of asthma. Very, very important instruction. So please take care. If you have asthma, don't do it. People who have any stomach surgery or recent back surgery, they should not do it. Again, it seems very easy asana, and it's not a that way easy asana. Doing up to some extent, it works well. Beyond that, we should not stretch ourselves. It is a stretching asana. It is also known as Samvardhanatmak asana. So let's do a little bit preparation for this. Let's start with some butterfly so that our legs, our joints of pelvic girdle, it will be flexible. Let's do that. Okay. So let's do butterfly. Let's go for Dandasana this way and very slowly try to part your legs and bring your right leg, keeping a heel touching to the perineum. Your complete foot is touching to your thigh and your vertebral column, your backbone straight. So sit straight first. Breathe out. Breathe in. Take your hands up and very slowly with the breath out, try to hold the toe with both the hand. First step. Those who cannot hold the toe, just you can be as much as possible with your only up to your capacity. You can just bend. Okay. Don't force yourself. Don't pull the toe. Just if you can do it easily, it's good. Otherwise, do it up to your extent. So breathe out. Try to touch your knee with your head and breathe out completely. Observe the stretch you have in the complete abdomen and back, and you have a stretch in the knee and hamstrings, thigh, the thigh muscle. Try to touch and be there for 10 to 20 seconds. If you cannot hold your breath in this condition, then you can have a breathe in, breathe out. Slowly breathe out and come back. Breathe in and breathe out. Breathe in and breathe out. Observe the stretch you have in the complete leg. Observe the stretch you have in the knee and back. And this works very well. Let's do it with other leg. Keep your left leg down with the feet touching your thigh, your heel touching the perineum. Perineal, perineal space is between genital and anus. Keep your leg parted from your other leg, straight. Breathe out. Breathe in. And slowly breathe out. And hold your knee, hold your toe, and try to touch with the complete breath out your knee with your head. Observe the stretch you have in the thigh, Janushirasana. Observe the stretch you have in your tummy. You may find that this particular asana, many players they are doing, it is recommended to them for the strength of their calf, thigh muscle, reduction of belly fat. This is a very common asana
across the sports people.
Without and within and slowly breathe out. Believe it, if we do Dhanushirasan at least 2 or 3 times with empty stomach, it becomes a very good mood enhancer. A person who does Janushirasan will always be smiling. So this particular asan or position is used for removal or reduction in anxiety. It is used for reduction in sinusitis. If you have digestive problem, it definitely helps to reduce it. If you have a long sitting hours and after that there is a ache, definitely this particular asana helps it to reduce the pain. And if you would like to build thigh muscles, calf muscles, and strengthen your knees, this is the asana for chest. People who are suffering from depression, they can definitely go for it and they will get the good results out of it. One important contraindications along with the use, if the person is suffering from the loose motions, okay, the person should not do this particular asana as it gives a huge pressure on the tummy. It is said that doing a Janusharasana 21 to 40 days every day, you will find the shape of your sight will definitely change. Your breathing capacity, breathing strength will increase with the Janusharasana. It will increase, of course, the musculoskeletal coordination of your body. Person who does Janusharasana, you will find more joyful than the other people. Janusharasana is a one very good asana. Okay, so let's go for the next pranayam. Let's have the position of lotus and let's do Kapalabhati 21 times. Okay. So breathing Kapalabhati is explicit breathe out and passive breathe in. When we explicitly breathe out, we have to give a kind of jerk to the tummy so that it is breathe out completely. It is said that during the Kapalabhati, you should breathe out half, not full. If you try to breathe out full, you'll be tired immediately, and that won't work for Kapalabhati. Kapalabhati is equivalent to an oxygen mask given to you. So it is half breathe in, half breathe out. Right? You should have a mulban, that is pulling your perineal, genital, and anal muscle together up. Let's take a deep breath. Breathe out. Take a half breath and start Kapalabhati.
I found this for you.
Take a deep breath and breathe out. And that was a Kapalabhati. Let's have the Bhastrika and then let's go to Shavasana. Keep your both the hands beside the shoulder. Breathe out completely. Close your fist. Keep your mool bandh intact. Breathe in. Explicit breathe in. And explicit breathe out. Before that, keep in mind those people who have arrhythmias, high blood pressure, angioplasty, or any cardiac problems, they should not do it. Open heart surgery people completely avoid it. So explicit, breathe out. Again, breathe in, breathe out. Let's do it 20 times. Eyes closed. Lie down very slowly, facing the sky, distance of 1 feet in the legs. Arms are 6 inches away from your body. Fingers are half curled. Your neck is tilted on the left. Take a deep breath. Breathe out. You will find that because of Janushirasana, head to knee position, you may have some little ache in your lower back portion that will go away after some times. Breathe in, breathe out. Relax your toes, heel, calf muscles, your knees, thighs, pelvic region, tummy, chest, relax complete back, shoulders, arms, elbows, forearms, wrist, palm, neck, face, No fold on the forehead. Release the tension from whole body. Pay attention to sounds you have in your room, from outside. Pay attention to your thoughts, your touch to the ground, dryness in mouth. Move your left foot, move your right foot, move your left arm, right palm. Turn your neck towards right. Slowly turn yourself towards the right. Take the support of the right hand below the head. Keep your hand relaxed position on the thigh. Be there in the transition position at least 10 to 20 seconds. So that it can connect Shavasana and complete awake position. Very slowly with the help of left hand. Come back to the sitting position. Keep your eyes closed. Legs are folded in Sukhasana. Backbone is relaxed but straight. Rub your palms. Rub them over the face, ear, neck, The thought of resilience, slowly open your eyes. Wish you very happy day. Thank you so much. Very nice day to you.